Welcome back to In the Know. We are talking all about We Are What We Eat today on In the Know with Dr. Mike. So vitamin D or vitamin D3, I'm going to ask you to specify or tell me what the difference is because everyone calls it vitamin D.
Exactly. So vitamin D, that's the vitamin because it's a fat-soluble vitamin. But vitamin D3, again, is the active form. So this is cholecalciferol. So this is the active form. And so when you're looking at a vitamin D product in the health food store, you definitely want to make sure it has D3.
Okay. And so we are deficient in vitamin D3. We don't get enough sunshine.
Well, we live in a country where it's unfortunate that we're just starting to see the sun. So the sun is upon us, I think it's interesting, but we are definitely deficient, and it's no point to test because we all are deficient. I've tested patients in my office multiple times, and so they're all deficient. I haven't seen one patient that hasn't been deficient, that's, of course, unless they're supplementing. And so the example is, you can have 3 tins of sardines, or you can have 1 dose of a vitamin D3 supplement at 600 IUs. So you'll get it from food, or you can have 20 eggs for the equivocal dose of 600 IUs of vitamin D3. So supplementation makes it easier.
Right, for sure. Why do people need vitamin D?
Vitamin D is extremely important for the immune system. It's one of the most important things that it encompasses in terms of helping the body's overall health and well-being. So it's the immune system, and sometimes the immune system we need to fight infection. So it's actually really good at priming the immune system to help with the armies that we have in our bodies to sort of fight off and ward off infections. There's been many clinical studies affiliated with low vitamin D3 and cancer, low vitamin D3 and infection and influenza. So vitamin D3, especially around flu season, is extremely important. And this is when we want to supplement it the most because that's when just the sun's not out or we're just always inside because it's just too cold.
Right. Okay. So it's the happy vitamin, is that right?
And that's it's the happy sunshine vitamin. So interestingly enough, the key point here is that seasonal affective disorder is directly related to having low levels of vitamin D3 in the blood. So light therapy is what these patients need to start having. So they have these giant, huge lamps and their lights in their homes. And also if you have skin conditions and atopic dermatitis, this is also important because the research does show that if you have a dermatitis or a form of allergy, low levels of vitamin D3 will actually encourage this even more. So patients with low levels of vitamin D3 are predisposed to having more allergic reactions. Okay. So we see it commonly in kids, and we're going to use an example later on in the show about a wonderful case.
Yeah, okay. So, I mean, thanks to companies like D-Drops, the marketing is there. Parents know about it now.
Absolutely.
I think for my generation at least, we're giving our kids D-Drops. But again, everyone needs vitamin D. Everyone
needs vitamin D3, and depending on what you're consuming. I mean, the new standard now is 2,500 IUs, international units. This is growing awareness. But Health Canada definitely recommends 600 to 1,000. And so for conservative reasons, that's what we'll recommend to some of our viewers. But of course, if you're treating a condition, you'd have to use a little bit of a higher potency and more of a therapeutic range, depending on what you're treating. And we'll talk about an example a little later. But one major key on why I like this particular company is because it's how they isolate the D3. The D3 comes from the lanolin of the sheep's skin. So this is extremely important because it's not from a GMO source. Okay. So I believe they source it from New Zealand, which is very important as well. And that to me just shows that a company is going over and above instead of just getting the run-of-the-mill. So the other sources are corn, and of course, we have our concerns with getting the vegetarian, extraction of a vitamin D3 versus a live animal. Okay,
and for omegas, we showed this brand earlier. There are brands that have a combination omega vitamin D.
Yes, and it makes for a perfect combination because you have a fat-soluble vitamin in a very, very long-chain fatty acid. So together, you can actually increase and ramp up your vitamin D3 levels quicker. I may add that also, most vitamin D companies will actually put a coconut or palm oil inside the vitamin D3 drops as well to add for that fat solubility.
Okay, so this is what it looks like. It's just a tiny little
you want to try
bottle. I'll try it. I'll just hold it there so we can see it. tiny little bottle. Do these need to be kept in the fridge?
Cool.
Cool. Okay. So in the fridge.
Well, you don't want to put it over the heater, let's just say.
Okay. And then there's no little...
No, you just have to invert
you
that.
just kind of do that.
Yeah. Put one drop.
It's not coming out. But that's okay. One little drop. Can I do it on my hand?
Yeah, you can just hold. You just have to hold it. You just have to hold it down.
Don't shake.
Yeah, it's gravity.
It's gravity. There we go.
There you go.
There we go. One little drop. And this one we don't have to worry about adding a fat component to it because of the coconut or palm oil.
Yeah, and it's a medium chain triglyceride as well.
Okay.
And so moms, nursing mothers,
Yes.
which have their infants are going to be deficient in vitamin D3. So what is recommended and what I recommend my patients is they can just add some either to the child's mouth or on top of the breast and then let the child drink.
Yeah, easy.
And, yeah, it's just easy.